Hi, my name is Angel Mays. I am currently in Lamar University Joanne Gray Dishman School of Nursing Baccalaureate of Science in Nursing program. I've been married for 5 years. My husband and I have 2 children with one on the way together, and I also inherited 2 stepsons from previous relationships. I've obtained my LVN in 2011 and I practiced in the long-term nursing setting. I later obtained my RN in 2016, and I have experience in nursing rehabilitation and the progressive care unit. Obtaining my bachelor's degree in December will only be the stepping stone for my nursing career. I enjoy being able to practice nursing in an autonomous role with patients and family members of the public who are or may become physically, emotionally, or financially vulnerable. Humanity and society construct outcome. The objective was met 100% by ensuring to practice safe and effective nursing in a holistic way, centering patient needs by incorporating evidence-based findings and theories from a global approach. An example of meeting this outcome was in nursing leadership. We done the global health PowerPoint. The next outcome is lifespan health continuum construct. This objective was met by 100% by supporting patients in preventing diseases, promoting or restoring health, maintaining wellness, and advocating for dignity while dying. I also evaluated patient-centered care for patients with common and complex health needs and compromised multiple health states. This outcome was reached. One was practice care of communities, and this when we done the practicum planning and the windshield survey. Also, in the multiple health states course, we done CSBO activities, and then we done practicum reflections 1 through 4 all reflected this outcome. The next outcome is evidence-based practice and clinical reasoning. This objective was met 100% by synthesizing clinical reason and judgment in nursing practice utilizing critical thinking, the nursing process, research, and evidence-based practice. In the multiple health state course, when we used, we had 4 practicum reflections that all required researching for evidence-based practice and clinical reasoning. The next outcome, patient-client centered care. This goal was met 100% by using safe, effective, patient-centered care while using theories and evidence-based findings to collaborate with patients and members of the interprofessional and intraprofessional healthcare team. An example of this was multiple health states, and we done practicum reflections 1 through 4. The next outcome was professional roles. This objective was met 100% by differentiating professional integrity, effective communication, active inquiry, and service to the community. Also by differentiating multiple role dimensions and practices within ethical, legal, regulatory parameters when caring for patients as a member of the interprofessional and intraprofessional healthcare team. Example of this outcome was nursing theories class. We had a DEC paper. Then also in the care of communities, we had the CSBO civic pride and diversity assignment as well. So in my 5-year plan, next year I plan to have a CNA class, which will be fully functioning with funding in place for those of the people who can't afford the classes. So basically, I always had a dream to initiate a CNA program for maybe new moms or someone who was just needing a job and needing a trade in nursing and actually have a spirit to be a nurse. I already initiated looking for funding for like Port Arthur residents. Once this course is finished, I plan to submit my application to get my classes actually functioning. Let's see. In 2020, I plan to expand my CNA classes. I plan to offer these classes online, and then they would just have to find a way to do clinicals to get those hours. I want it to be available to all the people worldwide. 2021, I plan to branch my CNA school to different trades such as like phlebotomy, welding, medication aid, or electricians. My husband is an electrician, so once he turned out, he may be able to take apprentices. So I would just want to expand the workforce. So hopefully in 2021, I'll be able to have a trade school. In 2022, I plan to franchise my trade school worldwide and initiate a new nursing business. I hadn't decided where, but I just plan on doing something new. I guess by then I'll know what my next business will be. And in 2023, I plan to start a nursing staffing office, and that will assist worldwide for like nursing shortages. Like maybe they can travel. I just want to just be able to be a nurse entrepreneur. Other than that, I'm still undecided if I want to go ahead and further my education, get my master's. Do I want to be a nurse practitioner? But this is my 5-year plan. And here are my references. I really hope that you enjoyed my PowerPoint, and thank you for listening.